Hi, my YouTube buddies. I wanted to come to you and let you know that I had an explant. Explant means I had my implants taken out. I had them taken out for a couple different reasons. One, they were too big for my small frame. I'm like 5'2" and a half, 5'3" on a good day, and I weigh about 115 to 120 pounds. And I felt like they were too big. I felt like people were looking at them instead of me, and I wasn't used to that. Some people like that. For me, I just wasn't used to it. So I had them removed for that's one reason. Second reason is that this side I could feel something and it bothered me. So I didn't want it to capsulate. Capsulate is when you get tissue that grows around the implant. It becomes very hard and it kind of cradles like an egg. It kind of cradles the implant so that in time it gets harder and harder. So that when you do want to have your implants removed, it takes them 3 hours to remove it because they have to take the whole capsulation. A good doctor will take the whole capsulation off to get rid of anything that's in there that should not be in there. Your body creates its own shell, which is really interesting. It creates its own shell around the implants when they capsulate. So I had that in my head. I had a lot of different things going on. I figured I am 63 in 2 weeks, and it was too many things for me to think about that could go wrong at my age. I'm not trying to rush my life or anything like that. So for me, that was another reason why I got them out because I was feeling something here when I move it. It felt uncomfortable. So on Tuesday, which was 5 days ago, because it's now Sunday morning. So Tuesday, 5 days ago, I had an explant where they take the implants out. I've been doing well. Obviously, the first day or two, you feel out of it because you have the anesthesia and they're giving you drugs that you're taking, so you feel out of it. Also, they did drains, which I didn't realize they were going to do drains because I did not do my research as well as I should have. But they put drains in, which is good. Drains on both sides. So the drains is what kind of hurts. If I step back, you can kind of see the drains. So, but anyway, the drains, it gets rid of all the fluids and any blood that's left in the cavity where the implants was. That's to help eliminate any kind of infections, any kind of imperfections that will happen once you remove the implants. Luckily for me, I've only had them in the implants in for a little over 3 months. So my situation probably isn't as bad as others who've had them in for 10, 20 years and then decide to do the explant. So as far as my pain and how I feel great. I just want these drains removed, which they'll get removed on Tuesday, which means I will have them in for 7 whole days and they'll remove the drains. Once those removed, I'll be great. On this past Friday, I was able to take a shower. You can't take a shower for 3 days, so thank you, Jesus. I was able to get a shower on Friday, so I got to see what my boobs look like. They look fine. Yeah, they have to reshape themselves and fill in. But as far as wrinkly skin, as you can see, it looks like I have implants in because I have this ace bandage on, this kind of holding them in so it can help push out any fluids that's in it. And then I have a surgery bra on. So, but as you can see, I'm still puffy here, which when this comes off, I won't be puffy there. It'll just be back normal. Like I told you before, the reason why I got the implants because I felt like I was going flat here. I don't care about going flat there anymore. It's all good. It's all good for me. So for me, the implants didn't work. For you, it may work for you. Get your implants if you want. It's all psychological. And for me, my psyche, whoops, for my psyche, it didn't work for me. So that's why I have them removed. But as far as the explant, I'm happy with that. I'm happy to be back the way that I was. I don't feel like I'm fake. Like, oh my God, like she looks good because look at her boobs. No, you can look at my boobs and they gonna still look good. If they don't look good, I don't care. It's this healthier for me at my age, my body frame for me to have the explant. So I just wanted to share that with you. Didn't want to be phony with you that I still had them and all is great because no, I don't have them. I will follow up with you once these drains come off on Tuesday. I'll follow with you, a few days later to let you know how I'm doing, and then I may give you a sneak peek. Oh yeah, one more thing. They did cut me from here to here, which that part I'm not happy about. I wish they would have cut me underneath and taken them out that way. So I'll find out on Tuesday why they cut me from here to here. I already had incisions from here to here when I got the lift, which finally they had cleared up. You couldn't even see any scars. Underneath the breast, yeah, you could see scars, but from here to here, you couldn't. Now I'm gonna have to deal with getting rid of the scars all over again. But I'd rather get rid of the scars and deal with anything feeling not normal, in my breasts and all of that. But I'll follow up with you guys to see how I'm doing. It'll let you know how I'm doing. And thanks for watching, my YouTube buddies. Bye.